Armenia, a small country in the South Caucasus, HIV infection continues to be a major healthcare concern. 228 new HIV cases were registered in 2012, and over 1,500 cases have been documented since registration of HIV infection began in the late 1980s. But there is hope. The United Methodist Committee on Relief, UMCOR, is working to prevent new cases of HIV infection in rural communities of Armenia. Since 2008, and with financial support from the United Methodist Global AIDS Fund, UMCOR Armenia has been working to reduce the risk of HIV and AIDS through a project called Prevention and Control of HIV/AIDS, Sexually Transmitted Infections, STIs, and Tuberculosis, TB. This project provides a full cycle of prevention activities for HIV/AIDS and sexually transmitted infections, including awareness raising, confidential health services, and condom distribution. In addition, by connecting with patients and community members at risk for contracting TB, the project aims to prevent the development of multi-drug resistant forms of TB and to detect new TB cases. Patients testing positive for TB are referred to available treatment resources. This combination of HIV and TB-related activities increases efforts to prevent HIV-TB co-infection in some of the most vulnerable regions in Armenia. UMCOR Armenia also informs pregnant women and women of reproductive age about the risks of mother-to-child transmission of HIV and how they can prevent transmission from occurring throughout pregnancy, childbirth, and breastfeeding. Expansion of the project in this area has been very well received, and many pregnant women and women of reproductive age have expressed willingness to participate in trainings, along with relatives and other community members.
It was again very important for the rural communities because pregnant women very often do not have access for this information and do not have access locally for HIV testing So through this project they were able to get this information on HIV prevention and also confidential and free of charge testing for HIV.
Most of the women attending UMCOR's trainings enter with little knowledge of issues related to HIV/AIDS, and participation in the training allows them to significantly increase their knowledge. The sessions are conducted in a friendly atmosphere, and trainees participate actively in the discussions and ask questions. Trainees are also given the opportunity to complete voluntary counseling and testing on HIV without leaving their village. All training participants receive informational materials, and pregnant trainees receive layette kits. To complement the training of community members, UMCOR also conducts on-the-job training for local medical staff. UMCOR's success in prevention of HIV and AIDS, sexually transmitted infections, and tuberculosis is seen through positive behavioral changes in target communities and by increased community access to preventive clinical services.